Thank you for joining us for the COVID-19 briefing for Newfoundland and Labrador today, Friday, February 26th. Marks 2 weeks since we began the second lockdown. I know there's a lot of people anxiously awaiting what's next, so I'll turn it immediately over to Dr. Fitzgerald.
Thank you, Premier. Good afternoon, everyone. Thanks for joining us today. Since the media advisory yesterday, we have 4 new confirmed COVID-19 cases in our province. 3 are in Eastern Health, and they include 1 person between 20 and 39 years of age, 1 person between 60 and 69 years of age, and 1 over 70 years of age. There is also 1 new case in Central Health between 20 and 39 years of age and under investigation. The total number of cases in our province is now 977. There have been 52 new recoveries, 48 in Eastern Health, 3 in Central Health, 1 in Western Health, leaving 287 active cases in the province. There are no new or outstanding presumptive cases. 11 people are in hospital due to COVID-19. 384 people have been tested since yesterday for a total of 111,049 tested to date. While today's low case count is encouraging, it is far too early for us to draw any conclusions. There is still risk of community spread in the Avalon area, and this region will remain in alert level 5 for the next 2 weeks. We will reassess at that time. Travel into and out of the metro area should be avoided unless essential. All indications are that the outbreak has not resulted in community spread in the rest of the province. We will therefore start to ease restrictions outside the Avalon. We are taking a slow and gradual approach to ensure that more movement of individuals does not result in increased transmission of the virus. Effective midnight tonight, all areas outside the Avalon region will move to alert level 4 for the next 2 weeks. This includes Labrador-Grenfell Health, Central Health, Western Health, and Zone 4 of Eastern Health, which encompasses the Burin and Bonavista Peninsulas, as well as Clarenville area and the Isthmus. If you live in these areas, you should stay at home as much as possible and work from home if you are able. You should stay within your household bubble when you are not at work or school. However, you can expand your contacts by a small amount if necessary. Bubbles need to remain small, exclusive, and local, and you should only include other people if it is necessary to keep you and them safe and healthy. As examples, it is okay to support an individual who is isolated or needs support, or to bring caregivers into your home. Organizing a social gathering, such as having your extended family over for Sunday dinner, would not be acceptable. Informal social gatherings are not permitted. Gatherings at funerals, burials, weddings, and religious and cultural ceremonies are limited to 10 people, provided physical distancing can be maintained, and public visitations and wakes remain prohibited in level 4. Recreational activities, outdoor playgrounds, and equipment can be used. Gym and fitness facilities, yoga studios, tennis and squash facilities, arenas, dance studios, and performance spaces will remain closed. Healthcare services, private health clinics can reopen in accordance with the guidelines. Visitor restrictions in healthcare facilities, long-term care homes, and personal care homes remain in place for the next 2 weeks. Many of these facilities have only recently completed vaccinating residents, and we want to allow time for vaccine effectiveness to increase before increasing visitation in these facilities. Businesses and services, childcare services in level 4 can expand to full capacity. Retail stores, including those in shopping malls, can open at 50% capacity, provided physical distancing can be maintained. Personal service establishments, including spas, aesthetic services, hair salons, body piercing, tattooing, and tanning salons, can open in accordance with guidelines. Restaurants remain closed for in-person dining, and bars, lounges, bingo halls, and cinemas remain closed. If all goes well, then these areas can move to alert level 3 in 2 weeks. We will be assessing the epidemiology and compliance with measures consistently over the next 2 weeks to determine if regions can decrease their alert level. I and my team have met with the Department of Education and both school districts and have provided the following recommendations to reduce the risk posed by the B117 variant. Teachers should wear level 1 mask and eye protection, at all times when in close contact with students and/or staff. Students in grades 4 and above will be required to wear a non-medical mask at all times except when eating or drinking or engaged in physical activity. We do encourage masks to be worn whenever possible. For students in grades K to 3, non-medical masks are recommended if they can be worn consistently in accordance with the non-medical mask guidelines. They will not be required. Students that are not able to cohort need to maintain a distance of at least 2 meters from one another. K to 12 schools and post-secondary institutions on the Avalon under Alert Level 5 will continue with online learning for the time being as COVID continues to circulate in the region. As promised, today we're unveiling our COVID vaccination plan for phases 2 and 3. Every Newfoundlander and Labradorian who can get vaccinated should get vaccinated. If we could vaccinate everyone today, we would, but we receive a limited amount of vaccine each week, and that's why we have a phased vaccination plan, protecting those most at risk of developing severe illness from COVID-19. Regional health authorities are almost through vaccination for priority groups in phase 1. And to help plan and coordinate vaccination clinics as we transition to phase 2, we are asking all residents of our province aged 70 and over to pre-register for their COVID-19 vaccination. You can do this online by visiting the Government of Newfoundland and Labrador's COVID website. If you don't have computer access, you can call toll-free 1-833-668-3930. The phone lines are open every day from 8 a.m. to 8 p.m. Although we know that most everyone will be eager to register, there is no need to rush. While it is important to pre-register, it will not determine your place in line to receive the vaccine. It will not be first come, first serve. So to ensure everyone can get through, we ask that you register by date according to your last name. Last names beginning with A to F, you can pre-register today to Sunday. For last names G to L, you can pre-register Monday to Wednesday. And for last names starting with M to Z, you can pre-register Thursday to Saturday. As of Sunday, March 7th and onwards, anyone 70 or over can pre-register. You will be contacted when a vaccine appointment is available for you. If you already have an appointment booked for your vaccine or you have received a vaccination, you do not need to pre-register. The following groups will be offered vaccination in phase 2. Adults over 60 years of age, starting with those over the age of 80. Adults who identify as First Nations, Inuit, or Métis. Staff, residents, and essential visitors at congregate living facilities, such as shelters, group homes, and correctional facilities. Frontline healthcare workers, both public and private, who may have direct contact with patients. First responders, including career and volunteer firefighters, police officers, border services, and search and rescue crew. Those who regularly travel in and out of the province for work, including truck drivers and rotational workers. Adults in marginalized populations, such as people experiencing homelessness or precarious housing arrangements. Those aged 16 to 59 who are clinically extremely vulnerable. And our vaccination plan includes a list of conditions that would apply under this criteria. And frontline essential workers who have direct contact with the public during Alert Level 5. Once most people in phase 1 and 2 priority groups have been immunized, the vaccine will be offered to all adults in age 16 to 59 in phase 3. We will start with those over age 55 and decrease by 5-year increments. We expect phase 3 will begin this summer. However, timelines are dependent on vaccine supply. We ask for patience as we move through our priority groups. When it is your turn for a vaccine, please make the choice to be immunized. The vaccine is a safe and effective way to help protect yourself, your family, and your community from COVID-19. As a recap, for those who may have just joined us, we have 4 new confirmed cases since yesterday's media advisory, and the total number of cases in the province is 977. These may seem like small steps forward, but such is the nature of a pandemic. COVID-19 has certainly challenged us and tested our resolve over the last year, and I have no doubt it will continue to do so as we move into year 2. The people of our province have shown time and again that you have the determination to do what it takes to defeat COVID-19. I have confidence that we can look forward to better and brighter days ahead. So hold fast, Newfoundland and Labrador. Thank you.
Well, thank you, Dr. Fitzgerald. With restrictions easing everywhere off the Avalon, now is not the time to let our guard down. We cannot get complacent. We must remember to social distance and ensure that we do not have social gatherings at this time. It's not okay to get together again just yet. Wash your hands frequently. Make sure you wear a mask and wear it properly. The COVID variant is still active in our province, and as we know, it's more contagious and more dangerous. As we have seen on the Avalon, it can have a big impact in a short period of time. We've gone from a record stretch of no cases to 2 weeks of double digits, and now finally back to single digits today. COVID works like a roller coaster. We may be going down now, but it can easily and quickly go right back up again. More people are in hospital, and sadly, unfortunately, there has been one death this week. Yes, recoveries are up, but we all must realize that we are still at risk. Keeping the Avalon at alert level 5 for another 2 weeks is absolutely the right thing to do. This is the epicenter of the variant outbreak. 2 more weeks of restrictions is our best chance at containing and stopping the spread of this disease. The bright side of all of this is the news of the next phase of the vaccine. And I can't stress enough, as Dr. Fitzgerald already has, the vaccine is safe, and it is necessary for us getting through the COVID world and out the other side. It's important to talk to family we have over 70 and get those appointments booked. I also worry about those seniors that may be living alone. If that's you, please reach out to Eastern Health. They will walk you through it and get your appointment booked. If they are your neighbor, maybe reach out and give them a call. Vaccinations are our biggest step forward in the fight against COVID-19. I know we are all anxious to know when our turn will be to get vaccinated. The delivery schedule is promising, and soon we will move to the next phase to protect even more of the people in our province. So please keep your spirits up. The light at the end of this is growing a little brighter every single day. So with that, I'll turn it over to Dr. Haggie for a few remarks.
Thank you very much, Premier. Day 355. And as I sit here through those days and even longer, the one thing that strikes me very clearly is the rapidly changing environment that COVID has provided us in the way of challenges. We have gone from 0 to having over 550 new cases in less than 4 weeks, and we're heading back down, hopefully, towards 0 once again. We've seen variants of concern emerge, such as the one that seems to have been at the root of this. Our information on the vaccine rollout plan that you see on the internet had to be amended less than 4 hours ago as a new vaccine became available potentially later on this month, rather later on in March in Canada. St. Clair's Mercy Hospital, 2 days ago, the situation there was portrayed to me as contained. And again, a further round of testing has shown more cases and the need for further investigation and further active cross-infection measures there. And we've seen now the vaccine. Phase 1 is not yet complete. So if you are in phase 1 and have not yet had your vaccine, please don't think that we've skipped you, because that is not the case. And I would like to re-emphasize Dr. Fitzgerald's comment that no one who wants this vaccine and is eligible will be left behind. The timelines that you see in the document are those that we think are realistic. They are based on what we have been given as guarantees by the manufacturers thus far. But as we saw in February, when they couldn't live up to that, we had to slow down. And given their current promises over and above this, there is a distinct possibility that we may be able to speed up significantly. It all depends on the number of doses that are delivered and available to us as our shipments arrive. The fewer we get, the slower this will be. The more we get, the faster this will be. I think the other thing that needs re-emphasizing is that public health measures that we have at the moment need to be followed. The possibility of relaxation off the Avalon should not be taken lightly in the sense of feeling that the worst is over and we can relax, because we can't. This is not the time to go visiting the malls and then go back to the Avalon, nor is it time really to go and visit family, other than for essential or healthcare reasons, who live on the Avalon if you do not. We can beat this. We have done it before, but we need to, as Dr. Fitzgerald says, hold fast for a bit longer. So thank you very much, Premier. I'll hand it back to yourself.
Well, thank you, Minister. I'll now open it up to the media for questions.
Thank you, Premier. For the benefit of our speakers, there are 8 reporters registered for today's call. We ask all those on the line to ensure your lines are muted until it is your turn to speak. The question and answer session will be conducted in 3 rounds, where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. Following this, I will ask each reporter if they have 1 final question. Our first questions are from Peter Cowan with CBC. Please go ahead.
Last time, as we were moving through the alert levels and we moved into alert level 4, we allowed a double bubble. This time you're saying, yes, you can see a few more people, but only if it's essential. Why the different approach this time?
So I think we've learned a lot over the last, well, it hasn't been quite a year, but feels like it's been 10, I think. But we have learned a lot over that time, and I think right now we realize that a lot of the transmission that's happening is within those small social groups as well as gatherings, and especially with this variant, we're seeing a lot of very quick and easy transmission in those small social groups. So we're really trying to limit the potential spread. As we open up, as we try to get the society back to functioning as it should, we're trying to limit that if a case of a variant did happen to show up here, that we would limit that spread as much as possible, and we feel this is the best way to do that.
Can you go over what about the current situation on the Avalon right now led you to the conclusion that it's not safe to ease restrictions, and what are you going to need to see 2 weeks from now in order to begin easing them here?
So we're still seeing active cases. We still have contacts and who may, test positive. There is still that potential. It hasn't been even 2 weeks since our last case, right? So we do look for an extended period of time with a significant decrease in cases, and we just haven't had that time under our belt yet to see what's happening. We want to, I think with this variant, given what we've seen about its spread so far and how easy it is to spread, we want to really take our time and make sure that when we come out of this, that it will be safe to do so.
Thanks.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you. Moving on to the vaccine rollout now, and it's been said numerous times that our vaccine rollout plans are contingent upon vaccine supply and a number of other factors. Based on what we know right now about our situation and how things are right now, how likely is it that we will be able to officially start with phase 2 in April?
So certainly if our supply remains as it is, I think the outlook is good that we'll be able to start phase 2 in April. But we always have to have that caveat in there that it does depend on supply. But based on what we have the information that we have right now, we feel comfortable with April for phase 2.
Okay, and I think that this next question will be best directed towards Dr. Haggie. Obviously a much larger group set to be inoculated in phase 2. Do we have enough staff to handle such an increase in demand?
Certainly, it's a good question, and the short answer is yes, we do. We have a very good public health system set up for vaccination, and with other providers willing and able to be co-opted, we showed very clearly that with the flu season, for example, 80,000 vaccinations a month was realistic, and that, I think, is something we would strive to exceed should we be able to get enough doses to do it.
Thank you.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. Dr. Fitzgerald, can you clarify where teachers fall in the vaccination outline? When I look at the NACI guidelines, they fall into phase 2 nationally. Just wondering where they fall for us provincially.
So right now, we're talking about essential workers. So essential workers fall in phase 2.
Okay, just to clarify, they will be able to be vaccinated in phase 2, and so they'll be able to reach out in mid-March. Just looking at the outline here, I just don't see them listed. It's the only reason.
No, so we've not listed a lot of individual groups. So, those reach outs will be happening as time goes on.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Kellyanne actually asked my question about teachers. What decisions went into putting rotational workers into the phase 2 list?
So when we looked at, what our risk was, where our risk lay, we knew that certainly these groups that worked away and were coming back to the province frequently and working in areas with higher prevalence posed a risk. That was our greatest risk of importation and our greatest risk of outbreak. So from a protection of the population point of view, having those workers who are traveling away to work, having them protected from the vaccine seemed to be a good strategy to reduce our overall risk. We are still learning about the effect of the vaccine on transmission, but I think given what we know at this point, it was certainly worth, given our epidemiology, worth having them on the list to reduce the overall risk to the population.
Okay, and I'm not sure if this is for you or for the minister. I just asked David Dunn if he can confirm reports that there are as many as 17 people hospitalized with COVID at the Health Sciences Centre. He suggested I was in the ballpark. So what are the actual numbers there?
Minister, that's probably best for you. You're specific to the health sciences?
My understanding is that there are 11 people hospitalized due to severity of COVID, and 5 of those are on intensive care.
Okay, thank you.
Our next questions are from Jason Piercy with Rogers Communications. Please go ahead.
Hi, thank you. I suppose this is a little bit of an extension of what Peter was asking just a few minutes ago. There's undoubtedly a lot of disappointed persons on the Avalon right now, which is understandable, but also your perspective of it is understandable too, because we know that all these decisions are made from science and the data that points us to those decisions, and I suppose it seems reasonable, given that any scientist would have a particular set of metrics that they would need to have met in order to draw any particular conclusion. I suppose my question is, are you employing that type of situation when we're deciding to move from one special measure or alert level or whatever into another, or is it a little more by feel and a little more ad hoc than that?
No, certainly we are providing, or we are using science and evidence and epidemiology to look at how we should open things. We're still learning with this new variant as we go. But based on what we have seen so far, we've made decisions, based on how we see this virus transmitting, how rapidly we see it moving from one person to another, and just the numbers that we're seeing and how quickly it grew. So, we're certainly employing that public health science to make these decisions. There is certainly a cautious approach that we're taking with this because we don't want to overwhelm our public health or health system capacity. So I think, using that cautious approach is important in this situation.
Thank you. It makes a great deal of sense. I suppose it's certainly not necessary for you to announce it publicly, but do you in your mind have a metric or a thing that has to be seen for a certain amount of time before you feel like the Avalon is safe to open up a little?
So I think we need to see, a steady low case count for a period of time. We also need to know that, it appears that the circulation of this new variant is reduced, and I guess time will tell us that.
Okay, thank you very much.
Our next questions are from Roger Bill with the Shoreline News. Please go ahead.
I have two questions, both of which I think can be answered with yes or no. The 4 new cases, have they been traced back to known cases?
One in Central is still under investigation, and that came in not long before we came out here, so I couldn't comment on that one. And it is my understanding that the ones in Eastern are contacts.
And the second question, when you were talking about expanding the bubble, I think you were talking about here on the Avalon, and if you were, I like you can't have extended family over for Christmas dinner, but can the nan and pop go to their adult children's home and help with child care for infants and young children?
So the bubble expansion, so to speak, happens in alert level 4, not in alert level 5. So alert level 5 is, the Avalon is staying with alert level 5 right now. But yes, so
Right, I
it's,
misunderstood.
yeah, so it is about, if you need to provide care to someone. So, if you have to connect with your parents who may need some supports, or if you have children or grandchildren and they need some supports, whether it be childcare or something along those lines, those are the types of interactions that we're talking about. We're talking about significant, necessary interactions for, enabling people to be able to return to work or to provide support that people need, to help get them through this. But it's not sort of those social gatherings that you would have with your family, not yet.
But here on the Avalon, you can have those essential.
So at this time, the Avalon would stay with the household bubble, and if you're a single person bubble, you can join with one other, as we have been for the last 2 weeks.
Our next questions are from Courtney Zwicker with All Newfoundland Labrador. Please go ahead.
Thank you. I was wondering if you could describe your approach to administering second doses of vaccines to people while there are still so many people who are needing their first dose of the vaccine.
At this point, the National Advisory Committee on Immunization are still recommending that everybody have 2 doses as close to the manufacturer's recommendations as it can, but up to 42 days. So we have certainly wanted to make sure that our most vulnerable populations have gotten 1 dose, but we are still looking to make sure that we give that second dose in accordance with those recommendations. So if we have to stretch it out to 42 days, we will, but we certainly are still looking to provide those 2 doses at this point. And, really we have to go by the science and the evidence, and that's what NACI follows, and that's why we follow NACI. But if new evidence becomes available that says, we can alter that dose interval or something, then, we will certainly follow that lead.
Great. And a question about the newly approved Astrozeneca vaccine. I'm wondering what we know about the logistics required for transportation and refrigeration for that vaccine, because with the other 2, we knew that there were some differences there.
Excellent question and a good news story.
Yeah. So the AstraZeneca vaccine is what we call a 2 to 8 degree vaccine. So it's stable at between 2 and 8 degrees. So it basically can be transported in the traditional way that we've always transported vaccines and can be kept in a fridge.
Great. Thank you.
Our next questions are from Patrick Butler with Radio Canada. Please go ahead.
Hi. First of all, I wonder, could you give the amount of people that you expect to be vaccinated in each phase 1, phase 2, and phase 3?
I don't have a breakdown of the number of people in each phase. except to say at the end of phase 3, I hope that there's 527,000 people who are vaccinated.
I could only offer one statistic there, Patrick, and that is there are just over 76,000 people in the province aged 70 and over.
And on that, I guess, ages, children getting vaccinated, is there a plan for vaccinating children and how that will work?
So at the moment, none of the vaccines have been approved for anyone under the age of 16. So, so we won't, at this point, it is difficult to develop any kind of a vaccination plan for children when we don't have approval in that group. I'm sure as, those studies are being done and are ongoing as we speak. So I'm sure as time goes on, we will have more information on that and we will be able to start doing vaccinations for children.
Our next questions are from Peter Cowan with CBC. Please go ahead.
Question about the AstraZeneca vaccine that was approved today. Its efficacy is lower than the two vaccines that we're already using. How will you decide who gets AstraZeneca versus Pfizer versus Moderna? And what would you say to people who are worried that they might get the AstraZeneca and they'll be less protected than people who got the other one?
So what we have to remember about these vaccines is that it still offers protection. And it still offers pretty significant protection. It depending on the age group you use it in and how far apart you use it, it can be anywhere between 65 and 70 and 80%. So, these are things we have to remember. Certainly, we have to consider who those vulnerable populations are and who are most at risk for severe disease. And, we have to offer them the protection that they need. We're still looking at ways that we can incorporate AstraZeneca into the plan and how best to use it. Certainly anybody who, people will know which vaccine they're receiving and they'll have to consent to their vaccine. That's standard with any vaccine. So, but the thing is with the AstraZeneca vaccine, there may be that opportunity that allows us to get to people faster. So, there's a lot to consider, but it's still better than not being protected, right? And that's what we have to remember. This is still quite an effective vaccine. If we compare it to the flu vaccine, sometimes depending on the year, the flu vaccine may not be this effective, but we still give it and we still use it and it still reduces the spread of the flu. So, and it protects people against the flu. So we have to remember that. This is a safe vaccine. It is effective. And people need to remember that.
And Minister Haggie, I want to ask about the capacity to do vaccinations. You've talked about the fact that we can do 80,000 vaccinations a month, even during the pandemic. This vaccine is going to require 2 doses, though. So by my math, at that rate, it would take us more than 11 months in order to vaccinate everyone we can. So how are you going to increase that capacity so that we actually get everyone who wants it vaccinated by September?
That's a very good question, Peter. It's an issue of prioritizing. With the flu vaccine, you may recall that we used our existing public health clinics and mechanisms, and we also co-opted other practitioners in fairly small numbers, actually, across the province. We have contingency plans through the regional health authorities to redeploy staff who have, as their part of their scope of practice, the ability to administer vaccines. And that may involve a variety of strategies, including limiting some of the planned services in regional health authorities. It includes things like bringing back retired folk with maybe minimal training. It also, if need be, an advice from staff is that we can introduce what's called micro-credentialing, which is where you could take people who don't technically have the license to vaccinate, but whose scope of practice may, for example, involve giving injections. So we have a tiered approach to that, and exactly how much beyond 80,000 we can get by enrolling those various tiers, I think time would tell where we need to go down that road. So we have some arrows left in our quiver yet.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you. Dr. Fitzgerald, on the vaccination plan, there's a little asterisk by the essential workers, and that asterisk says that workers who are in Labrador who cross the Quebec border daily are not included in the essential worker vaccination group for phase 2. Why is that?
Are you talking about essential workers or about the rotational workers?
Pardon me, yes, rotational workers.
Yes, so we're talking about people who are going away to areas with higher prevalence, and we know that these areas have quite low prevalence, very similar to Labrador's prevalence, in fact, and so it's not the same risk.
Okay, and Dr. Fitzgerald, I believe you mentioned in your opening remarks that teachers will have to wear, when they do go back, will have to wear face shields and masks, the combination of the two, and I believe that daycare workers have been told the same. We've talked before about how face shields aren't as effective and that face masks were always the preferred method for the first line of defense. Can you expand on why we're asking teachers and daycare workers to double up now?
So face shields and eye protection are used to protect the eyes, not to protect the breathing. The mask is to protect the breathing. You don't have to wear a face shield. It can be eye protection. That can be goggles. So what I said was eye protection in a mask. We're still learning about this virus. We don't know exactly how easily it spreads through the eyes. Just to be cautious and to provide the most protection we can. We want teachers to be protected and have their eyes protected as well, which is why we made that recommendation. So a face shield is not about protecting your breathing. That's what the mask is for. Face shield is about protecting the eyes.
Thank you.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. When it comes to the hospitalizations, I just want to clarify the numbers for today, noting that 11 people are in hospital. That doesn't include those at St. Clair's that have since tested positive due to the situation on Unit 6E, correct?
The Minister?
Yeah, we have only ever reported those people with COVID who were admitted to hospital because of the severity of their COVID. We have, both in the calls wave, the first wave, and in this, a number of people who were found to be COVID positive for various reasons, having been admitted with other things, for surgical procedures, as an emergency, these kind of things. That is not usually reported. I don't have that number to hand, and I don't know whether public health would have that easily available, but I can certainly go looking.
Thank you. And Dr. Fitzgerald, yesterday we saw the increase in ICU admissions up to 5. That's the most the province has seen through this pandemic. One, how concerning is that, and how is our capacity for handling the increase to ICU?
So obviously, yeah, it is concerning. We certainly have heard that there have been reports that this variant can cause more severe disease, and when we're looking at our hospitalizations and ICU admissions, we are seeing them a little earlier than we would have had expected based on the original strain. The original strain. Where that lag time was a little bit longer. We're seeing a little bit earlier in disease. So we're watching this very closely. With regard to ICU capacity, I think that question is probably better answered by the Minister.
Yes, thanks very much, Dr. Fitzgerald. Yes, Eastern Health are the ones that are really kind of affected by this, and they have a stepped response. They've already triggered part of that. So once they reach 5 patients in their regular ICU, they have a system to clear up and mobilize extra ICU beds. So they have done that, and they now have 13 ICU beds immediately available, with 2 other steps would produce 10 each. There are sufficient ventilators to actually effectively more than double the number of ventilators that we currently have at the moment. We will run into staffing challenges when we hit 70 people at intensive care.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
the only passing reference I could believe was made to travel, but it strikes me with retail stores being open in other parts of the province, you're going to have a lot of people traveling back and forth despite warnings. Is there anything that you're planning or hoping to do to mitigate that?
So certainly we've said that any travel off the Avalon should be for essential purposes only. So that would be work, or if you had to get medical attention, or if you had to provide urgent care to somebody. You know, people should not be traveling unless it is required to do so. So I'm hoping that we won't need to put anything in place. I hope people that will understand that the importance of doing that, and will comply with the measures to try to reduce the risk of disease transmission. So.
Okay. And I wanted to clarify with AstraZeneca, we've had a few people who said at 60% efficacy, they don't feel it's very effective. But is it not true that it also has an 80% less serious symptom and a 100% avoidance of death? Like it has different numbers according to what it can do, not just simply prevent it.
Yes, so certainly that's a good point, Peter. We do have to remember that these vaccines right now are being given, you know, we don't know the effect on disease transmission. That the numbers when we're quoting vaccine effectiveness, we're talking about antibody production, that we also look at the incidence of severe disease, hospitalization, and death, and all of those parameters are reduced. So, you know, this is why it is so important to understand that, you know, these vaccines are safe and effective, and Health Canada has approved them based on that.
Thank you.
Our next questions are from Jason Piercy with Rogers Communications. Please go ahead.
Hi, thank you. So we have 11 persons in hospital with COVID-19 and another unknown amount who would have already been admitted for other concerns prior to their contraction. So for those persons who suffer from anxiety and are currently in a very difficult way, it feels like it might be important to disclose, with as much respect for the privacy of these patients as you can, whether or not we're speaking about otherwise healthy persons who were hospitalized, or whether these persons were already at a greater risk based on what we know about COVID-19, especially those 5 or 6 that are in ICU.
So I think you're talking about two separate streams of patients there, Jason. I don't know if you want to try to provide clarity, Dr. Fitzgerald.
So, you know, I don't...
I suppose what I'm asking is the people who ended up in hospital through COVID-19 symptoms, especially those that are in ICU, is there anything you can tell us, while still respecting their privacy, about their overall health prior to contracting it, for those of us who are worried that if we do get sick, are we going to end up in ICU?
So what we know about COVID-19 and B117 and many of the other variants is that age is your biggest risk factor, right? So the older you are, the more at risk you are for severe disease, and the more at risk you are for being hospitalized and unfortunately dying. So those are the facts of this disease. That is the biggest risk factor. We do know that people who have certain conditions may be at slightly higher risk as well of having severe disease. But really, you know, it's hard to say, because each individual person is different, and the risk is different, and we have had young healthy people in hospital in ICU with no premorbid conditions, and then we've had, you know, 95-year-old people who have lots of conditions who've had very mild disease. It depends on so many things. It really is hard to generalize. And I certainly, you know, am not, I don't think it would be useful to discuss any of these, you know, few people that are in hospital, any of these comorbid conditions that might exist if they do. To be honest, that's a level of information that myself as someone in public health doesn't get to really, except to talk about it in more general terms. but I don't deal with the patients on an individual basis in that regard. So it's not information that I easily have access to. We think about it more on the bigger scale. So, and I don't think discussing the medical histories of these few people will change what the reality of this disease is for people. I mean, it is what it is, and what's out there in the public now with regard to risk factors still applies.
Okay, I understand. I appreciate you taking the time to explain it as best you can. I suppose just as a bit of a follow-up, when it comes to the vaccination rollout plan, I'm wondering, is that a health department or public health decision or assessment process? Is it a Liberal government decision or assessment process? Who puts that plan together that we released today?
So that plan was put together by the public health team. And, there was lots of consultation across the country about how we do this. We took advice from NACI, we took advice from ethics consultations, and from medical experts as well. So it's based on that advice, and the public health team put the plan together, and with its recommendations for how it should be rolled out. And that's the plan that you have.
Wonderful. Thank you so very much.
Our next questions are from Roger Bill with the Shoreline News. Please go ahead.
I don't know if it's a question for Dr. Fitzgerald or Dr. Haggie, but I'm 76, so I'm looking forward to April. And out of curiosity, I just went on to the pre-registration site, not to register, but just to look at it. It's down for maintenance. Was it supposed to be up and live now?
Probably best for you, Minister.
Yes. In actual fact, yes, I checked before I went on the air, and in actual fact, there were already 2 people registered at just before 2 o'clock. So I'm not quite sure what's happened there. Certainly, it was our understanding that it would go live when the news release went out more broadly to the public. So whether or not there's some... Yeah, maybe there's some last-minute tweaking, but it has been up and running because I checked on it earlier, Roger.
And for Dr. Fitzgerald, are you aware that that there has been a donation made towards land conservation with the Nature Conservancy of Canada on your behalf?
I believe I was aware of something that was made on behalf of all CMOHs. Is that what you're talking about?
Yeah, I read it in All Newfoundland Labrador yesterday that somebody's made a donation on behalf of yourself and Dr. Robert Strang, Jennifer Russell, and Heather Morris, and your counterparts in the Maritimes.
Yes, I did. I did see that. It was very lovely.
I was going to ask you what are your thoughts about it?
Well, I love nature, and so I'm very pleased that somebody felt or thought to make a donation in our names. I think it's a lovely thing to do.
Prefer that to having your name on a building?
I think we're going to get both, Roger.
No, I would.
Thank you.
Our next questions are from Courtney Zwicker with All Newfoundland Labrador. Please go ahead.
With every passing week, we're getting closer to tourism season, and a lot of operators are already looking forward to an Atlantic bubble. I'm wondering what needs to happen for us to reopen the bubble again.
The bubble is, I guess it's a question for both of us, but the bubble is still a long ways away yet. I mean, we'd have to move from 5 to 2 and then reevaluate the epidemiology in the adjacent jurisdictions and where we are. So we're trying to contain it as best we can on the Avalon right now, and that would be a decision for a future time.
Great. Thanks for everything.
Our next questions are for Patrick Butler with Radio Canada. Please go ahead.
Hello. This would be a question, I think probably for the Minister of Health. We've seen sites for signing up to get your vaccine, or say making an appointment, crash in other provinces. There's been issues with call centers. I mean, we've seen it with Elections NL, with the high demand of people trying to call in to register for voting. Can you talk about some of the measures that you've taken to ensure that that won't happen, and maybe talk also about the staffing levels at the call centers right now?
That's a very good question. We learned from some of our issues with the call centre, and my understanding is they are staffed up well beyond what they would normally have for the introduction of this service. We particularly would like people to do what we did with the flu vaccine, which is to use the website as a port of first call. We do acknowledge, though, that with some seniors that may be a challenge, and that's why the phone line is set up and running. We have got NLCHI prepped and ready to go in the event of any website volume issues. But I think one of the things we need to remember here is patience. You don't have to be first on the site to get the vaccine before everybody else. We're trying to do it in a staged way. The lines will be open for 12 hours from 8 in the morning till late at night, but anybody who is in the queue at 7:59 at night will be answered. So you have a 2 to 3 day window for trying to pace the site and the website. And then at the end of that period, it will be open up for anybody who didn't have the opportunity to go when their surname was in the list, as it were. So again, no one will get left behind. We are pre-registering at the moment in anticipation of vaccine availability, dose availability, coming at the end of that process and nearer, if not in the beginning of April. So we have done what we can. We're conscious of what happened in Alberta and what happened in other jurisdictions and our own experience. And we think we've done what we can behind the scenes to try and mitigate that.
I also have a question regarding how we define severity of illness. There must be some people with respiratory diseases who have concerns about limiting phase 2 to only those who have been hospitalized in the last year, given the last year was one in which there was a goal to keep people out of hospitals unless it was absolutely necessary. So my question is, why not open it up to anyone in phase 2 with serious diseases, serious respiratory diseases?
So we tried to, there is, as we said, limited of vaccine. So we wanted to get those who are at highest risk for severe disease. And so we know that people who have more severe disease, and there are definitions of severe disease. So we're trying to limit to those with the highest severity of disease. Recognizing, that a lot of people in these categories will be captured by the age recommendations as well in phase 2. So we certainly will endeavour to get everybody, but we want to get those at highest risk for severe disease at this point. And this, that list was developed with consultation from specialists in the fields, and it's not just one we threw together. So it has been developed with that lens.
Before we move into the third round, I just want to remind all those on the call to make sure your phone is muted so that we can avoid the inadvertent coughs or rustling. All right, Peter Cowan with CBC, you're up next. Go ahead.
Thanks, Leslie. Dr. Fitzgerald, I'm wondering, is there going to be, or can you provide a list of who qualifies as an essential worker? I know people are already wondering whether or not that includes everything from grocery store clerks to teachers, home care worker, or daycare workers, things. There's going to be a lot of questions about that, so I'm wondering if you can provide any clarity about what that covers or who that covers.
So initially, it'll look at people who had to work front lines in alert level 5, as is described there in the plan. And certainly, we have some groups we have to get through. We have to get through those older groups, groups of older people first. And so as we work through that, certainly, we'll have more information available as time goes on.
And what's going to be done to enforce these various qualifications? Because in the next phase, there's a fairly large list of different types of people. Are people going to have to, for example, show proof that they qualify, or is it going to be more based on the honor system?
So I think those are questions we're still working on. So hopefully we'll have answers to that too as time goes on. I mean, hopefully we'll have enough vaccine and we won't have to worry about it. But, if I'm really saying what I'm hoping for. But We'll see.
Thanks.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you very much. Dr. Haggie, we're still hearing some concerns about ventilators in the province. You've mentioned on a few occasions now that we have quite enough ventilators. I think that more so now the concerns that I'm hearing are about the operators of the ventilators. So my question is, how many staff does it take to operate one ventilator? And with the increase in hospitalizations that we've seen, are staffing levels to operate them of any concern?
That's a very good question, and unfortunately, I can't give you a simple answer because, as always in clinical medicine, it depends. If you have a stable patient, and they do exist in intensive care, then you can kind of share those out in a way that you can't if you've got a highly unstable individual. We are conscious, however, that there is an increase in lab capacity for blood gases, an increased requirement for respiratory therapy, for physical therapy, for people who are ventilated in numbers. And we've got ourselves in a situation at the moment where you're quite right. We've got way more ventilators, 300, I think, critical care ventilators now because of the orders compared with what we used to have. Our challenge will be to figure out how to redeploy staff with appropriate experience. That is very much more of an operational question with the RHAs. But again, recently retired RTs, recently retired RNs with ICU or emerge experience, or staff with anesthesia background. These are lists that the Regional Health Authority has compiled. The colleges, the licensing bodies have agreed to be flexible, and they will grant to people they feel fit the bill, as it were, temporary licensure for working under those circumstances. So we have some contingency plans, and we continue to look at ways to expand that pool. But given the very short period of time that you might have to do that, it's not possible to set plans in motion, and it's not possible to have plans set in stone. So again, I go back to my comments in the introduction: flexible, ever-changing, and a challenge.
Thank you. And this next question, I guess, would be for Dr. Fitzgerald. Can you address the restrictions that are in place for families with loved ones who are sick or dying in hospital? We heard from a woman on Open Line this morning who was distraught that her family had to fight with hospital staff, those are her words, to get one family member in with their dying father. Can you address those restrictions, please?
So my understanding, and I didn't put in any restrictions with regard to this, but it's my understanding that there are guidelines in place for palliative care and how many people can visit, and that had been updated with Alert Level 5. But I can't speak to any individual cases.
Thank you.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. As we see part of the province go to Alert Level 4 and the Avalon stay at Alert Level 5 right now, are we looking at doing the 28 days between each to move back, or at any point could we potentially go from Alert Level 4 to Alert Level 2?
So at this point, we're taking things slowly. We'll be watching the epidemiology and just see what's happening. We'll be watching not only that, but what's happening elsewhere in the country, and we'll make our decisions at that time. But at this point now, we're looking at, if everything stays well off the Avalon, certainly after 2 weeks, they'd be able to move down an alert level. But we will be watching things closely.
Okay, great. Thank you. And when it comes to vaccinations here, where does it stand for those who have tested positive? Because obviously we know people could potentially get this disease again. So just to clarify for a lot of the questions I'm getting here, just because you've tested positive for COVID-19 doesn't mean not to get the vaccine.
No, that's correct. There are some guidelines for people who've had COVID in the past, and I know that they are looking at looking at that very question now to see is there any evidence to determine what is the best option for people who have been infected with COVID. So as we have more information, certainly we'll be reflecting that in our vaccine plan.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
I'm fine. Thank you very much.
Thanks, Peter. Our next questions are from Jason Piercy with Rogers Communications. Please go ahead.
Yes, hello. So everybody in the province knows that our healthcare makes up a large portion of our provincial budget, and obviously the pandemic is clearly having an impact on that also, which is expected, and obviously an important way to prioritize our funds. My question, I suppose, is about how we're monitoring that, and if we know where we compare to the rest of the country in terms of per capita, how much this pandemic is costing us, like when it comes to testing or treatment, or even the time that we spend on these updates.
Well, I don't know that we have the granular detail and time on these updates, but I'm sure, Minister, you have some intel compared to other jurisdictions.
Yes, a significant proportion of our early healthcare expenditure in terms of PPE and training and supplies was actually covered by federal funding. I think I've got a figure of $100 million at the back of my mind, but I may misspeak. I can certainly go back and check on that. In terms of operational funding, I am not being advised by my staff up until the caretaker started that we were any worse off from a financial point of view coming towards the end of the fiscal year this year than we had been in previous years. And indeed, in some areas, we may be slightly better off. So that's the best I can do at the moment to answer that question. As to how we compare with other jurisdictions, really and honestly, I think we've all kind of taken the approach of, let's make sure the service is there and that people are cared for, and we'll kind of worry about the bills afterwards.
Okay, understandable. We're doing such a good job of tracking our infections and through COVID-19. I'm wondering, because this is also playing a big role in the mental health of our province, I'm wondering, are we tracking hospitalizations due to mental illness, mental health, addictions since the pandemic increased or happened? I think it would be interesting to hear whether or not there's been a spike during lockdowns and such things.
The short answer is we are tracking our admissions. We have regular reports for these areas as part of the Towards Recovery program. I haven't had any briefings on those because since the writ drop, I've kind of concentrated really on the COVID only, purely element. We do know that the online access has gone up. We do know that there has been a steady flow of people using doorways, for example, which we deemed an emergency service. We did, during the late part of last year, look at some crude statistics for overdoses, and it looked as though there may have been a flick of an increase around the time of the previous lockdown. But again, that's older data, and I couldn't give you the exact numbers just off the top of my head. So it's something that is tracked, but I haven't checked on recently.
Okay, thank you for doing your best to describe it. It's nice to know that people are taking advantage of what we put out there. Thank you.
Our next questions are for Roger Bill with the Shoreline News. Please go ahead.
Dr. Haggie, not a question, but I went back onto the pre-registration site. I must have hit it a couple of moments before the briefing started when it's still in the embargo period. But the site was fine. It's my first letter and my last name falls into this period to do the pre-registration. I went ahead and pre-registered. It was slick. It was easy, piece of cake.
So you're pre-registered,
Roger?
Roger?
Thanks very much, Roger. That's pleasing to hear. In actual fact, my phone did light up during the briefing to say it's working on it. He may need to refresh his browser. So I'm glad you said that. It's very helpful.
I must have hit it during the embargo period before the briefing started and it went live.
Thank you.
Sorry for the false alarm.
Everyone's excited to get a vaccine, Roger, I'm sure.
Our next questions are from Courtney Zwicker with All Newfoundland and Labrador. Please go ahead.
I'm fine, thank you.
Thanks, Courtney. Our next questions are from Patrick Butler with Radio Canada. Please go ahead.
Dr. Fitzgerald, Dr. Fitzgerald, knowing what we now know about the spread being limited to the Avalon, was it a mistake to move the whole province to alert level 5 rather than adopting a more regional approach, which we've seen in other provinces?
So, no, I think we based this information on, certainly when we did that, the information that we had was that we had widespread community transmission in the metro area. We did not know how wide that transmission was. We knew how quickly this virus was spreading through the group of people that we had here in town, and we knew that if that got anywhere else and got out anywhere else, it could be devastating for some areas. So I think we had to do what we did. We knew we were dealing with something new and different, something that was much more easily transmissible, and until we also knew that our public health capacity was stretched, and if we didn't do what we did and this virus spread across the province, it would not have been a good situation at all. So we did what we had to do, and now that we know what we know, we can make some changes, and that's that's what our plan was, and I think that's where we are right now. So we're very happy that there was no other spread anywhere in the province, and but again, as I said the last time, it's the paradox of public health. If we do something and nothing bad happens, people think that we didn't need to do what we did. But the fact of the matter is we don't know what would have happened if we didn't put those measures in place. However, I am fairly confident it would have been much worse than what we saw.
And at this point, if we're hoping that phase 3 will come to an end in September, is it fair to say that we'll see things like restrictions at the border or reduced capacity at restaurants, things like that, rolled back before we would get to the end of phase 3, so before the fall?
You're speaking of levels and vaccination levels combined, correct?
Yeah, so I mean the vaccine
I'm speaking specifically about phase 3, the vaccination.
Yeah, so what we have to remember is that we're still learning about how this vaccine will affect transmission, and we also have to think about not just our vaccination rates, but vaccination rates elsewhere, right? So it depends on what's happening elsewhere in the country and elsewhere in the world. So, really too far out to make any kind of predictions about that kind of public health measures at this point.
It sounds like we had a few reporters leave the call, but I'll quickly go back through each reporter to see if you have one final question. Peter Cowan with CBC, do you have a final question?
Thanks, Leslie. I almost always do. Question about the restrictions for Alert Level 4. I noticed that there's some changes compared to the last time that Alert Level 4 was put in place. So, for example, salons being open and non-essential retail stores also being allowed to open. So can you explain why the different approach this time around, and why not just move to Alert Level 3, in which many of those were already in there?
Yeah, so we looked at the where we are now, and we also, took the information that we had about how we know this is being transmitted and where we see the risks being, and the risks aren't there in the same way with these transient interactions like we see in retail, or we also wanted to reopen while reducing the risk as much as possible with regard to large gatherings or social gatherings and that sort of thing. So in these situations where you have clinics or aesthetic situations where it's more of a one-on-one interaction, provided physical distancing even sort of in a salon can be maintained, we felt that the risk really, if we did see a case, due to B117, that the risk of spread would be lowered significantly enough that we would be able to respond to that, and public health capacity wouldn't be too stretched. So that's what we were looking at when we made these recommendations. We didn't want to overhaul everything and say, we go from level 5 to level 3. We thought we would just modify the levels. There are some differences still in level 3, as we move into level 2. So all the levels will have changed slightly, especially with respect to gatherings, as I think that's an area where we really have to be much more careful going forward.
Thanks.
Richard Duggan with VOCM. Do you have a final question?
Yes, I do. And this is a question that came from a listener. This listener is asking about marine Atlantic ferry workers. They say that they're not being considered rotational workers, but will have to isolate once they get off the ferry come February 28th. They argue that workers don't leave the ferries in Port aux Basques or Nova Scotia for their whole shift. So the question is, why do they need to self-isolate when they're not being considered rotational workers?
So we've had discussions with Marine Atlantic about how their workers will be, how we'll, maintain safety and reduce risk of transmission. Some of these workers are coming into contact with people on the ferries, although Marine Atlantic has done a great job in trying to reduce that risk as much as possible. We're trying to be as cautious as we can with regard to reducing the risk of, especially the variants of getting back into the province. So we have had discussions with Marine Atlantic and with their with regard to their employees. So hopefully, we'll be able to keep the service running and maintain the health and safety of their employees as well.
Thank you.
Kellyanne Roberts with NTV. Do you have a final question?
Yes, thank you. Dr. Fitzgerald, in other jurisdictions across Canada, for those who are immunocompromised, have anaphylactic reactions, things like that, they've had to get a letter from their healthcare provider noting that they can be vaccinated. Are we looking at doing something the same here, or how should those who are immunocompromised go about determining if they should get the vaccine?
So certainly we're encouraging anyone where there are, those caveats of, discuss with your doctor. So what we're advising people is to have a conversation with their healthcare provider, whether that's their family doctor or a specialist if they're seeing a specialist, and decide if getting the vaccine is right for them. And if it is, then to book an appointment to have that vaccine. I think people can have that conversation. I don't know that we need to require proof that they've had that conversation. I think adults can be trusted to make that decision and to, when they consent to getting a vaccine, they consent that they have, that, they've made sure that they've had those conversations. And I think when we are, the people who are vaccinating are doing screening. So, if that comes up, they certainly have the ability to have that conversation, and they have the knowledge to be able to have that conversation with somebody to allow them to have an informed consent. But we do encourage anybody who has any of those conditions or is pregnant or breastfeeding and would like to have that conversation with their healthcare provider as to, what their risk is and the risk compared with the vaccine, that certainly we encourage you to do that.
Thank you.
Peter Jackson with The Telegram. Do you have a final question?
Yeah, I'm not high up on the list like Rogerville is, but I do have a kidney transplant, so I'll get one soon enough. I'd like to ask the minister whether there's any kind of a breakdown in communication if you did not know of an outbreak just a few days ago, and now we're hearing of one at St. Clair. Was that sort of some kind of miscommunication?
Actually, that's a very good question, Peter, but I think it goes back to my original comment about the ever-changing situation. We had a set of information and facts that were accurate as they were portrayed to me and then to you on Wednesday. And by Friday morning, the situation had evolved, had changed. And here we are, and Mr. Diamond's been out this morning presenting those facts out there, accurate at the moment. By tomorrow, those facts will have changed yet again, I'm sure, and our numbers will have changed. And we've seen quite dramatic shifts. And you only have to go back to Friday to see how things can change very rapidly in this environment. I think it's a useful opportunity, though, to point out that we as a government and as a department have actually gone way further than any other jurisdiction in Canada in making sure that we are available to the media to answer questions pretty well in real time as this pandemic has unfolded. And I think it's taken its toll on the staff preparing for these, and I'd like to thank them for that. But I think really it would be unfortunate if people got the impression that there was some kind of breakdown or some kind of deliberate attempt to not talk about things, because quite frankly, that is not been the case, nor will it be.
Okay, thank you.
Jason Piercy with Rogers Communications. Do you have a final question?
Yes, I do. Thank you. With the decision to test all patients and staff at St. Clair's, I'm assuming that those essential workers will be treated sort of like traveling essential workers will, in that they're permitted to go to work and then have to isolate on their off hours. And if that is the case, how would you recommend somebody in that situation who has shared custody handle that situation?
I don't think that's the case, but you can go ahead, Minister, and clarify.
I think as far as shared custody is concerned, we have been very challenged to lay down any kind of directive, because it then becomes an issue of the supremacy or primacy of a special measures order versus a court order from a judge. Justice and Public Safety have tried their best to navigate this with some general guidelines, and they are available on their website, and I think they're even linked from ours too. In terms of custody specifically, I think that unfortunately is a discussion between parents.
Was I wrong in the way that I described how those employees would work? Because if I am, then please tell me.
Well, again, I may have missed the beginning of that question in terms of the employees, but those are recommendations that will be based on Dr. Fitzgerald's guidelines. And I think that's where the rub comes, where there is an apparent conflict between those and a custody order. And I don't think either of us have the legal skills or the jurisdictional ability to rule on that.
Understood. Greatly appreciated, Minister. Thank you.
Roger Bill with the Shoreline News. Do you have a final question? Moving on, Courtney Zwicker with All Newfoundland and Labrador. Do you have a final question? And Patrick Butler with Radio Canada. Do you have a final question?
I do, and just looking for some clarity. When we say that the Avalon Peninsula is remaining at alert level 5, does that include the isthmus? Does it go all the way to Come By Chance? Can you clarify that?
No, it doesn't include the isthmus. So the isthmus will be in alert level 4.
Does that make sense, Patrick?
I guess so. I guess, is there like a community report on the CCH where this ends, just so that people will understand?
I would have to go back and review my geography now at the moment. I don't want to speak wrongly in public, but certainly in the SMO it'll be delineated.
Okay, thank you.
Thank you, everyone. Premier, do you have any final comments today?
Well, thanks everyone for joining. I know that was a lot to take in. There was a lot of information there, and thank you, Dr. Fitzgerald, and your team for being able to be here today and provide the information on multiple fronts. But as we've seen, as a part of the province moves to alert level 4, I want to make sure that everyone on the Avalon and the Isthmus East recognizes that we're still in alert level 5, and we need to make sure that we're obeying the rules as prescribed and clearly outlined by Dr. Fitzgerald and her team. And to those off the Avalon, level 4 is a new phase and is redefined from before. So make sure that you are fully knowledgeable of level 4. It's available on the website. And please, above all, maintain the basic rules that Dr. Fitzgerald and her team have been preaching from the beginning. Keep your distance, wear your mask, wash your hands, and check in on people to make sure that they're doing okay. And we will get through this, Newfoundland and Labrador. Stay safe.
Thank you, Premier.